Hello guys, welcome to another episode of Dr. Hafsa's Dental Channel. In this video, I will be discussing about trigeminal neuralgia from oral medicine. The topic today I'm gonna cover about trigeminal neuralgia are its definition, its pathophysiology, its causes, its signs and symptoms, its diagnosis, and its treatment. So first of all, let's go through its definition. What actually the trigeminal neuralgia is? It is actually the chronic, excruciating, short-lasting unilateral facial pain condition that affects trigeminal nerve, or you can say the fifth cranial nerve. Okay, now let's discuss about its pathophysiology. How does this occur? This occurs, or it is due to neurovascular compression of the nerve root, which causes focal demyelination. So in reaction, what happens? In reaction, it causes the hyperexcitability of the nerve fibers, which causes the episodes of intense pain. So that was all about the pathophysiology. Now if we talk about the causes of the trigeminal neuralgia, there are a lot of causes, but some of the main causes we come up with are: number 1, compression of the trigeminal nerve root by vascular formation. Number 2, it may be due to other pathologies like tumor, cyst, viral infection, trauma, and systemic diseases such as multiple sclerosis. So the next thing I'm going to discuss about trigeminal neuralgia is signs and symptoms, or you can say clinical features as well. It's up to you. So the basic signs and symptoms are: there is excruciating pain in trigeminal dermatomes, most commonly in both maxillary and mandibular branches of trigeminal nerve. There is unilateral pain, and the pain radiation is generally within the dermatome. And if we talk about bilateral pain cases, those are extremely rare cases. Number 3, the pain is paroxysmal, shooting, sharp, piercing, stabbing-like pain, or electrical pain, you can say. Number 4, pain episodes are identical in location, duration, and intensity within individual trigeminal neuralgic patients. Okay, now what is trigeminal neuralgic attack? Trigeminal neuralgic attack, it is the attack which is provoked by a pressure on a trigger point. Now what is trigger point? Trigger point is the terminus of the affected branches of the trigeminal nerve. So such triggers include shaving, talking, yawning, chewing gum, cold wind, noise, lights, stress, etc. Now let's talk about its diagnosis. What are the measures that we take to diagnose trigeminal neuralgia? Here are some of the tests that I have listed below. You can see, and these are really helpful to diagnose trigeminal neuralgia. Those are: number 1, CT, which stands for computerized tomography. Number 2, MRI, magnetic resonance imaging, or MRTA, which stands for magnetic resonance tomographic angiography. These all are the tests which are really helpful in diagnosing trigeminal neuralgia. Last but not the least, now I'm going to discuss how to treat trigeminal neuralgia. Trigeminal neuralgia treatment usually starts with medications. Some people with the condition may stop responding to medications, or they may experience unpleasant side effects. So for those people, injections or surgery provide other trigeminal neuralgia treatment options. So if the trigeminal neuralgia is due to multiple sclerosis, then the medications given to the patients would be anticonvulsants, for example carbamazepine, which is the most important drug used for trigeminal neuralgic patients, oxcarbazepine, lamotrigine, and phenytoin. Muscle relaxing agents can also be given to the patient, for example baclofen. It can be used alone or with carbamazepine. Botox injections can also be given that reduce neuralgic pain. If medications are ineffective, then we go for surgery. So what would be the surgical options? Here are some of the surgical options that I'm going to discuss with you guys are: number 1, microvascular decompression. In this, we remove blood vessels that are in contact with the trigeminal nerve root to stop the nerve from malfunctioning. Number 2, brain stereotactic radiosurgery. In this procedure, we use radiation to damage the trigeminal nerve and reduce the pain. Number 3, we can also give glycerol injection, which is also used to eliminate the pain of trigeminal neuralgia. We can do balloon compression, radiofrequency thermal lesioning, and rhizotomy, and many other surgical treatments are used for the treatment of trigeminal neuralgia. Thank you for watching. I hope that you will find my content helpful. If yes, do subscribe my channel, like and comment below the topics you want me to cover in the next videos. Stay tuned for more helpful videos.